June, National Smile Month. Good time to talk about teaching kids to take care of their teeth at a young age. Delta Dental of Minnesota is trying to help by giving out oral health bags to first graders all around the state.
So here to tell us more about that is Dr. Eileen Crespo, a pediatrician and the VP of Medical Services at Delta Dental of Minnesota. Thank you so much, Doctor, for your time. Tell us more about how National Smile Month, how did this all begin?
Well, just as there are months that commemorate different types of health, June is National Smile Month, so we can focus on oral health and how important that is in keeping your entire body healthy.
And we know at Delta Dental giving out to first graders. I do wonder why that age? What is it about that age that you think is really going to help the most?
It's a great question because they are little, but kids are very strongly influenced by routines. And we know that a healthy routine starts actually right when that first tooth erupts, where teeth are getting brushed right away, and kids are learning to do it well with parental supervision, of course. And so making it something that's fun, making it something that they want to do, and making it something that they're already used to doing every single day, twice a day, helps to kind of solidify those daily habits.
Okay, Dr. Crespo, I'm going to keep it real with you because we've got a 3-year-old at the house, and we've got him in good habits, right? We brush his teeth twice a day, we try to floss, but now he is starting to revolt against us, okay? We do this twice a day, so what would you say to a parent in that type of situation to continue to encourage those healthy lifestyles?
Well, you are not alone, AJ. These challenging 2- and 3-year-olds want to do things themselves and want to tell you kind of how things are going to go. So it's important that parents stay consistent. It's important that you make it as fun as possible. There's a couple different things you can do, either providing a reward that we usually say is like either they can watch a 2-minute video while they're brushing their teeth. You can brush their teeth anywhere in the house. If taking them in the bathroom makes it stressful, you can do it right in front of a screen. You can do it when they're out of the tub. You can do it when you're putting their jammies on. Because most of those little kids are not really spitting. They're kind of eating most of the toothpaste you're putting on, which is why you only add just a tiny amount. For that 3-year-old, just a pea-sized amount is plenty.
Dr. Crespo, we're talking about 3-year-olds, 3-year-olds, 4-year-olds, 5-year-olds. How much should the parent be brushing and how much should the kid be brushing?
What a great question. We get this all the time. Actually, we recommend that parents supervise toothbrushing until a child can actually tie their shoelaces, which is right about that first grade age group. So when the kids have that fine motor skills that they can, tie some shoelaces, we think that they can manipulate a toothbrush to turn it upside down, make sure they get in the back, get a really good cleaning all around their mouth. And that is really important that parents are watching that and making sure that's happening. We've all, I'm sure, tried the trick where you just wet the toothbrush and say, I'm already done, when you haven't really brushed. So it's important that parents are there and supporting and encouraging children to get their teeth brushed.
All right.
Lots of good information. Yeah. Thank you, Dr. Crespo, for your time. I know a lot of parents can be using some of that information.
Oh, yeah, absolutely. Thank you. The supply chain crisis